Hello, I'm Donal Macaulay. Thank you for joining me in this conversation with Chris vanWeel.
Yeah, I started my practice in Rotterdam. I was one of the first working in a health center, coming out of a situation where the 1960s general practice in the Netherlands was identical to single-handed male practice, and we were practicing in a community setting. We had the multidisciplinarity of the medical issues. We had nurses, we had physiotherapists, but we also had social work and social psychiatry. That was an experience at that time that was very difficult to match with other practices. Very few other GPs had this experience, few other countries. For example, that was one of what I found were the most difficult issues, to compare what our colleagues in Great Britain had that same experience. The general practice at that time was very disease, medical oriented. And so that experience has always been very important for me. When I moved to Nijmegen, into an academic career, I had to develop research in the academic setting. And again, there the initial problem was, how do you get your foot behind the door, between the door, and how do you get into an environment where they accept what we wanted to do. And of course, I think much of it already was in moving into this medical social context issue, but that would have been a bridge too far to start it. So I think what I initially did was pretty disease-oriented research that brought some sort of a respectability. And step by step I got into the more complex issues, from chronic diseases to multimorbidity, from multimorbidity into complex patients, the interaction particularly with mental health. And at this moment I see that the department I left a couple of years ago is continuing, moving into the community, moving into community needs, but in a completely different Dutch context, of course, where we don't have these completely left out cases. But what we did work on, one of the last things I did was work on general practice primary care for migrants, and particularly migrants without a permit to stay in the country, illegal migrants. And it was fascinating to see that general practice in the Netherlands in 2016, 15, 16 was able to link up to and provide care for individuals who were not in the country officially, and were providing top primary care for them, including them in top primary care. So I think that was a fascinating journey, and research is catching up on that, and is becoming much more international in that respect. So we're getting definitely out of the disease-specific mode into addressing health problems, patients with health problems, multiple health problems, complex issues, complexity. And the second is the relation of health and social well-being. And that's something I see also recently in Wonka, This is happening now virtually everywhere. It became for me my international home. I think it was one of the first international conferences I ever went to, and first conferences have something like your first girlfriend. You always come back to that, and so when I was still in practice in Rotterdam, I became a member of the Wonka Research Committee, as it was called at that time. So I built friendships and collaborations from that basis, and I used Wonka when I was appointed at the chair in Nijmegen, where I brought my research team to, and so step by step I became more and more involved in Wonka, and in the end I became president. And, I think I was able to lift the profile of research, international research, through my involvement in Wonka. And I think we made the very first, you could now call it a needs assessment of research, by having a conference in Kingston in 2003, where we invited people from as many countries as possible, and through Canadian we got a number from low and middle income countries, and we addressed what the needs for research capacity building around the world were, what the research priorities were, and what the specific strength of primary healthcare, family medicine in that was. So for example, the whole idea of building practice-based research networks, and you see that's a development now taking place in many countries. Yeah, and from that, when you focus research in the practice environment, you automatically come into the socio-economic environment of that practice. So you come to the social determinants of health, and so there's this broadening, there's this very specific primary healthcare focus of research on populations, individuals, populations in the context where they live and work, get sick and have to be improve their health. That's the mission of primary care research.